Hello, welcome. We'll give it a minute or two to allow folks to join. In the meanwhile, while we are waiting for folks to join, please feel free to drop in your name and your community health center in the chat. We'd love to know what part of the country you are signing in from today. My name is Angie M. I'm based out of Washington, D.C., where Healthcare Ready is located, but we are nationally focused. Let's see. Hey, Patricia, welcome. Washington, awesome. So good to see you all today. You know, throughout the conversation today, we may go ahead and allow folks to just reset your attendee status so that you can come off mute a little bit easier. And we certainly welcome y'all to join us via video and additional chat. Hey, Gary, welcome. All right. Hi, Kenya. Awesome. All right, so I think we can go ahead and get started. Welcome to the Crisis Communications webinar hosted by Archer and Healthcare Ready. Healthcare Ready, I'll briefly go into our background, but this is our, I think, fifth webinar in our series of emergency preparedness trainings. The Archer initiative is funded by the Centene Foundation for Quality Healthcare and held in partnership with our friends at the Association of Clinicians for the Underserved. The Archer Initiative serves community health centers and state PCAs across areas that are at highest risk of natural disaster. That includes our 3 states across the West Coast, and all the states highlighted there in our Gulf regions and that are at risk of tornadoes, hurricanes, and all the fun things. If you ever need access to our past webinars, you can reach them at our resource page at Healthcare Ready. Again, this is our 5th in a series of several different emergency preparedness initiative topics. And upcoming, we have disaster-focused toolkits, which will be sent out to all participating CHCs and PCAs. Later this month, we'll also have 2 additional webinars before the end of, or ideally before summer ends, on supporting staff through sustained and repeated emergencies, as well as communicating the business case for emergency management. And that's for any staff member who's looking to identify funding or just general support from their managers and C-suite. Briefly, again, my name is Angie M. I'm a research manager here at Healthcare Ready. I'm joined by my colleague and actual host of this webinar, Melanie Mackin, our lead research analyst. I think at this point, I would love to run our first poll, interested in knowing who here has attended one of these previous Emergency Preparedness Initiative webinars. For us, Healthcare Ready is a national nonprofit, 501c3. We are focused on ensuring that patients continue to have access to medical care during disasters. So we serve as the critical linchpin between the public and private sectors, ensuring that, you know, as we're coordinating, as we're responding, that we are doing that to the best of our ability. And really making sure that governments, local partners are able to find each other, talk with each other during disasters. Awesome. So I'm seeing the poll come in here. This is most people's first time with the Healthcare Ready. Welcome. Welcome to also those of you who've already seen this recording. Happy to share a little bit more about the services that Healthcare Ready can provide before, during, and after a disaster. I'll be on after the webinar. You can hang on if you have any questions. Most recently, I think how we worked with our PCAs, for instance, was to send out a donation offer that was sent by one of our partners in response to the recent tornadoes along the southeast or southeast. So happy to share more about Healthcare Ready at any time, but if you need us, we're here. We can move on to the next slide. Awesome. We're also curious in knowing, what is your level of experience working in community health center emergency preparedness? And that question really comes from the fact that we have folks here from all over the country that have signed up, over 120 registrants. So this just helps us to gauge your level of familiarity with the topic and content at hand, so that we can make sure to answer any questions that come up or tailor the content that's coming forward. So as folks are responding, it looks like most people have had more than 2 years of training. So we have a lot of veterans, but we also have several folks that are new to this or have been working on emergency preparedness for less than 1 year. Perfect. This webinar is intended to provide a high-level overview of crisis communications. We will touch on pretty much all the things. So I think that there will be something for everyone here. As far as the agenda goes, we'll start with just covering the objectives of this 1 hour presentation. A couple of quick icebreakers, because we'd love to hear from everyone who's on the call. I think that everyone has experience or questions that you can bring up, that we all have an opportunity to learn from each other. So please don't hesitate to share your remarks in the chat or in the Q&A. The bulk of the presentation will be spent on establishing a crisis communications plan, so that you'll have the steps to do the basics on creating a crisis comms plan, best practices for communications and stakeholder management, understanding that it can be a chaotic time for many folks involved. So I want to talk through, what are the leading practices to identify your key stakeholders, manage your communications there. Lastly, we want to spend some time talking about incorporating equitable approaches to communications. And that means both identifying your medically fragile populations within the communities that you serve, but also ensuring that there are several strategies in place to identify and communicate, reach those communities before, during, and after a disaster. We did receive some questions prior to the event, and I just want to touch on them here. Questions around whether or not a template would be provided. So we have several resources that we'll be sharing throughout the event. Most of them will be touching on them briefly to keep the conversation tight, but those resources will be shared at the end and will also be posted on our website following this webinar. There are no other questions. Again, feel free to use the Q&A liberally. You can raise your hands and we're happy to call on you and bring you off of mute to ask your questions. You can also just direct your questions in the chat to everyone here, and we have folks monitoring on standby to be able to address your questions. Lastly, on the objectives of this webinar, so ideally, we want to spend the next 60 minutes with you being able to come out of this webinar understanding how to incorporate equitable approaches to communications and messaging. So again, that means really regarding your patients, how do you identify them? What are the different ways that you should be communicating with them? Can be ensuring their safety both before and during and after a disaster. Secondly, identifying changing communications during crisis. So we all know that things change rapidly during a crisis. So what are a few ways, backup strategies that you can have in mind for methods of communication? What are the different tools that can be used? While there are many, I think, conversations that are going on across your health centers and PCAs, we won't be talking about the platform specifically. We don't want to be prescriptive there, understanding that your facilities and jurisdictions likely already have plans or processes or tools in place. However, we are happy to recommend different potential alternative platforms that can work if your main forms are not working. Lastly, learning best practices for communications and stakeholder management during crisis. exactly what it sounds like. So just thinking through what are the different channels and avenues, ways that you can be pitching your messages to make sure that those messages are getting through to the end recipients in these critical times, whether that's your partners on the ground, that's the fire department, police department, local emergency management coordinators, or whether those are your staff and your patients. What are the different ways that we can be sharing those comms? With that, I'm happy to hand it over to my colleague, Melanie, for the rest of the presentation.
Thanks so much, Angie. Thanks for getting us started. So my name is Melanie. As Angie said, I'm the lead research analyst with Healthcare Ready, and I'll be leading this webinar today. Again, invite you to use the chat if you have any questions, comments, or concerns as we go through the presentation. So to kick us off, I'd just like to start with a definition to really help us level set on what we mean when we say crisis communications. So crisis communications can mean slightly different things at different times, but for the purpose of this presentation and to help us meet those objectives that Angie touched on earlier, when we say crisis communications, we're referring to the systems and protocols that allow an organization to effectively communicate during an emergency or disaster. So really being able to communicate with your intended audiences following an event. So recognizing that the goal is communicating to different audiences, one of the things we're going to be discussing and thinking about a lot today is not only the message itself, but the intended audience. Within crisis communications, it's really important to remember that while everyone may need to have the same information or the same message, they may not need it at the same time. And that's because how they use that information may differ. And the way they may need it may impact the actions that they choose to take or the actions that they may not take. So first and foremost, on the far left here, you have leadership. A lot of times when we talk about crisis communications, I think a lot of us immediately start to think about our external recipients of information. But it's also critically important that we're thinking about how we are conveying information across our own organization as well. So that's why on the left here, you see kind of our two first buckets are leadership and staff. Recognizing that they are very different groups, leadership may need different information in order to make some of those decisions and act on decision-making that could impact their staff. However, when we think about staff, they may be a little bit more community or patient-facing. So because of that role, they would require a slightly different level of detail than that of your leadership or your executive team, or even sometimes known as your C-suite. Also when we think about staff and we think about a local event like a natural disaster, it's really likely that staff or their families could be experiencing impacts themselves. In this circumstance, that would be, of course, where HR would be a really important entity to communicate with, recognizing there may be personnel issues to deal with on top of the operational needs of your health center. And then we move over to patients and advocates. So really understanding here what information would need to be communicated out about continuity of care, medical treatments, what services may be paused during an event versus which ones may be available at your health center. You also may want to communicate how patients can get to your facility if a natural disaster has impacted any roadways. For external stakeholders and partners, understanding what information your external partners need and also having a really good sense of who those partners may be in your ecosystem that you can tap into during a disaster response. We spoke a lot to that during our Engaging and Strengthening Partnerships webinar, which, if you ever need any tips on how to work through identifying those partners, we definitely recommend referring back to that webinar. And then finally, the general public. So thinking about the information that could be disseminated through local media sources, social media, the radio, or any other news outlets. So I know we just talked a little bit about messaging to partners, but now we're going to think a little bit about how communications change during a disaster. So the challenges associated with communication during an event can vary depending on the type of hazard that you're talking about. However, like no matter what hazard we're dealing with, we often see that a lot of the challenges stem from damages to infrastructure or logistics issues. So thinking about the infrastructure that we rely on to share information during a disaster is, especially important as we continue to work in not only a remote environment due to COVID for a lot of us, but just recognizing that a lot of these hazards overlap and we may be dealing with different events at once. So when we're thinking about a natural disaster, when there may be a power outage or cell service disruptions, many of us use cell phones now. A lot of us don't have landlines anymore. So those challenges of infrastructure and what can happen when there are damages across the community are really important to consider. There's also staff communication. Like we just said, during a local event like a natural disaster, it's going to be really important that you're finding ways that you can communicate with your staff to not only understand what their needs may be, but also so that you're better understanding how they may or may not be able to support operations at your health center. And if they are, ensuring that they have the information that they need to do just that. During a man-made event, I think one of the greatest priorities is getting accurate, timely information to appropriate audiences. But this can also be a challenge. It's kind of twofold because you really don't want to send incomplete or inaccurate information because that could potentially have consequences. You want to avoid creating any hysteria. So it's really going to be a balancing act here to understand what your staff needs and ensuring their safety as well as the safety of your patients. That may be your first priority before you start to push out information to the public or any external stakeholders. And then similarly with infectious disease outbreaks, you'll want to make sure, again, that you're delivering timely, accurate information. But I think, something we saw during the pandemic is that it's also really important that we maintain some flexibility here and that we're clearly communicating to patient groups and to the public that, the information that we have at this time is based on the available data, but it's certainly subject to change in the coming days or weeks or months as new data emerges. I think we learned from COVID that it's really critical we do this so that we can get the public on board so that there's really buy-in when it comes to any public health interventions that may be implemented, like social distancing, the use of masks, vaccines, and any other preventative measures. And then finally, cyber-related events such as a phishing incident or hacking. The biggest challenge here is that you will probably or maybe experiencing a system outage in which your community health center cannot access the systems that you typically rely on. There may also be longer term implications here as it relates to determining how your organization is going to move forward with handling communications following the event. So thinking about who we may be communicating with, you can think of these three key groups of stakeholders that you typically may turn to during a crisis. First, in thinking about local healthcare partners, you may be thinking about them as you build or refine your communication plan about how you plan to communicate with other health facilities in your area during a crisis. We very typically see resource sharing among neighboring health facilities during a disaster, whether it's PPE during COVID or first aid materials during a natural disaster. So it's important that in your communication plan, you've identified which facilities you may be able to turn to and how you would get in touch with them during a crisis. This would likely require that you have an understanding of, whether it's your local hospital or another community health center, but that you know what their operating capacity is. So think about what it looks like for you to get that information. These are the things we really encourage you to build into your plan. And then invite, your stakeholders to review those plans and provide any input so that not only are they aware of how your health center may turn to them during an event, but also so that, they're prepared to give you that support. Thinking about your community outreach under NGOs on the right here, especially for some of those harder to reach groups. This is likely where you'll want to communicate and share information with community-based organizations or faith-based community groups, or even organizations that have the opportunity to support donation coordination or provide your community health center with medical volunteers. These groups may specialize in working with certain groups who are at higher risk during a disaster. So that's really important to note because it's important to know that you yourself and your community health center may not need to figure out new ways to reach certain groups, but rather you may be able to communicate with groups that already exist and are already connected to these patients to better understand and communicate how you may be able to assist. Being able to build this into your communication plan, how you may be able to check in with those patient groups is really important, and also helps make sure that there's an opportunity for your community health center to extend itself to meet your community's needs during an event. And then finally, thinking to our government partners, which could include public health, emergency management, or law enforcement at either the local or state levels. These groups, as we see, typically have a lot of redundancies. You may see different email addresses that allow you to contact them, or several hotlines that are stood up during a crisis. So there's a lot of information there. So what's important is that you identify in your communication plan, the exact place that you can go to contact when it comes to all of these government partners, and what activities they would take on to support your community health center so that your staff knows who to turn to for what and how to communicate those needs. That way, you know how to get in touch with someone when a crisis strikes. So now we're going to talk a little bit about how you can build, or if you already have one, how you can strengthen and maintain your crisis communication plan. So we're just going to start off with a couple of polls just to get a sense about where everyone on the call kind of stands with their communication plan at their community health center. So first, just curious, does your community health center have a communication plan? So we're seeing a lot of yeses and a handful of not sure's or no's, which is totally fine because we're going to talk a little bit about just building one, but also if you have one, how you can strengthen it. And then for our next question, we're just curious if you are, if your community health center has a standalone communication plan or if it's built into your emergency response plan. And again, there's no right or wrong answer here. We are truly just curious what, exists across the space for community health centers, recognizing that we are not one ourselves. So we're not typically sure how you guys go about it. So this is helpful for us to just have a better understanding. Awesome. So it looks like a lot of you have your community plan that's built into your emergency response plan, which completely makes sense, recognizing the requirements that are set forth for your facility with the CMS emergency preparedness final rule. So speaking of that rule, we presented on this back in our first two webinars. So I'm just going to quickly go over the need to know. We included the slides that were used during that webinar at the end of this slide deck. So if you need any other tips or additional information on any of the minimum requirements, that will be sent to you all following this webinar. So when it comes to the Centers for Medicare and Medicaid Services Emergency Preparedness Final Rule, within the 4 components, there is a communication plan. And under the rule, community health centers must develop and maintain an emergency preparedness communication plan that complies with federal, state, and local laws. Your communication plan should help to identify how your community health center will coordinate patient care within your facility, across healthcare providers, and with state and local public health departments and emergency management systems. And finally, at a minimum, your communication plan must be reviewed and updated at least every 2 years. So when it comes to the minimum requirements for community health centers, there are 5 that we're going to highlight here quickly. The first is that you are maintaining contact information for your staff and any other entities you typically work with. So you could think of like your IT team, any supply chain teams that are embedded within your organization. For the second one, that's really focused on any external partners, maintaining that same communication information when it comes to, government partners, regional healthcare coalitions, any external group you typically work with. For the third minimum requirement, it requires that you have in your communication plan any alternate means for communication should the systems you typically rely on go down. So that could be the use of radios, whether you'll turn to using texting if your systems go down during a cyber attack, anything like that. For the fourth requirement, it requires that you have a means of providing information about the condition and location of your community health center's patients. And this is really about in the event of an evacuation, if your patients had to go somewhere else for care, making sure that you have a means for communicating your patients' needs so that they can continue to receive the care that they need. And then finally, making sure that you have a means for providing information about the community health center's needs and its ability to provide assistance to the authority having jurisdiction in your area, which we typically see as local public health emergency management, or if it's more of a regional impact, maybe even the state public health or state emergency management. So with that background information on some of the minimum requirements of the communication plan, the next step is how do you put it all together to integrate these components into a single communication plan? Of course, the first step is making sure that you have addressed all of the final requirements so that you are in fact in compliance with the CMS final rule. But beyond just identifying how you would communicate with your staff, your patients, government entities, and other stakeholders, it's really important, again, how you identify those alternative means should your standard communication methods go down. Just as an example, if you could have radios or like walkie-talkies on hand that work in a close geographic area. So, if it's safe to do so, you certainly can drive to another nearby hospital or health facility, community health center, and exchange those radios so that you're able to keep in touch and keep in communication with them, so long as it's safe for you to physically move around your impacted area. Again, if that's something you choose to adopt, we just really recommend that you include it in your communication plan so that it's documented, and that's how you would handle a crisis. Identify in your communication plan how you would coordinate, again, patient care, not only within your community health center, but across your entire regional health system. If you're a member with your local healthcare coalition or HCC, they have response plans on hand too. So, reach out to them, review their response plan, see how they are planning to go about a medical surge event in your region. And if they're planning to share patient information, we recommend that you plug into that resource so that you would also have a means for communicating should your systems go offline. And then finally, it could be really helpful to formulate templates for messaging with different audiences you would communicate with in mind. So whether that is social media messaging, so a handful of tweets that you could push out to the public during an event, or a template that you could use when you're checking on the needs of your neighboring health facilities in your area. Those templates that you keep in your communication plan can not only save you a lot of time during a crisis, but they could also help to standardize how you communicate with other stakeholders so that you could quickly, efficiently, and accurately share situational updates. And then finally, just making sure that you are exercising, reviewing, and revising your communication plan, again, at least every 2 years, but certainly more often if you feel that is needed. So again, the overall goal of your communication plan should be to help your community health center coordinate patient care within your facility across healthcare providers in your area and with state and local health departments and emergency management systems. So You can kind of think of it as three parts to help you accomplish that, which is to test your plan through exercises, making sure that you are reviewing your communication systems frequently, and any dependencies that you rely on, and then revising your plan as needed as you incorporate new partnerships you may have made, any interventions that have been identified as successful, or lessons learned to help you strengthen your communication plan. And so in developing that plan, it's really important, we feel, to have that long, detailed document that you keep on hand. But we also recognize that's typically something that's more for internal staff with the main audience. Like, you're not going to hand a huge, long document to an external partner most of the time. So, definitely think about ways that you can share your communication plan with your external partners in a way that's readable, easily digestible, and shareable. So to that end, detailed plans are great, but they don't have to be the only answer. If you're able to, you can create shortened documents like checklists or quick guides that are just a really easy point of reference during a disaster. And then also making sure, again, that these things are documented. We want to avoid relying on those interpersonal relationships or friendships for our crisis communications plans. A former boss of mine always said, if I win the lottery today and I leave you guys, do you have everything you need to keep this company running? And so just really making sure that if someone was sick or won the lottery or for some reason wasn't there, you still can turn to any documentation to keep things running smoothly. So as you're building out your communication plan, be asking yourself these questions every step of the way. Does your plan need to identify partners? And almost always the answer is yes. And that's because partners help us meet the needs of our communities we serve during a crisis, when our systems are stretched too far for us to go at it alone. So be clear in your communication plan which partners you would reach out to and what information you would need to convey to them, and also what information you would want to receive from them. For example, when we think about our government entities as our partners that we work with during a response, we often see that public health departments and even federal entities at times want to see, what health facilities may be offline or which ones may have experienced damage. So identify which government partners you would want to share that information with about your operating status during an event, and make sure that you know how to communicate that to them, whether that's through a coordination call or through an email exchange. It will also be important to determine how long after an event you plan to communicate with them, and how you plan to stand down these crisis communications once your community health center starts to enter its recovery phase or return to your steady state or normal operations. When thinking to who your key partners would be, we often see that primary care associations are some of the first point of contacts that come to mind for community health centers. But also think about some of the critical infrastructure that could impact your operating status. Does your plan include how you would communicate with the power company that serves you if you're experiencing an outage? Or if you're experiencing staffing shortages, again, is there a non-governmental organization you could turn to support you with any medical volunteers? These are the types of things you'll want to look to ahead of time so you can build them into your communication plan. And you can certainly add these to your communication plan over time as you identify these opportunities. And then finally, making sure to clarify your audiences. Your communication plan should articulate which audiences receive which type of information, when they receive it, and you should also really describe how you may manage or share sensitive information. As an example, at Healthcare Ready, we use a color system like a traffic light. So red information really should not be shared beyond the recipient. Yellow has a little bit more flexibilities, can be shared with a person's own organization, and then green can be shared much more broadly. Having this practice in our communication plan really helps us know when we can share information to who, and it's just really helped us in a crisis get information out to the right audiences. And then within each of these questions, your plan again should describe how you would communicate with these people during an event, whether that's email, conference calls, social media, or face-to-face at times. And again, just make sure you're describing those alternate means of communication if your standard methods do go down. There's really no right or wrong way to do this. You really just have to consider what would work best for your community health center. But what's important is that you're making sure everything's clearly articulated in your communication plan so that when disaster strikes, you're well equipped to handle communication. And then after you build your communication plan, just making sure that you're reviewing it. So make sure you're reflecting on a couple of things. When was the last time you tested your communication plan? Is your team, staff, leadership, and anyone else comfortable with your responses and your crisis communication plan? Something we practice, in advance of peak hurricane seasons is we typically have a more seasoned or experienced staff member kind of take a newer staff member under their wing, review any of their external communications, guide them through how they would handle a request for information or assistance so that we know they're comfortable to move out on these things when it's peak disaster season and it's really all hands on deck. Think about how often you're updating your plan. Again, the requirement of the CMS Emergency Preparedness Final Rule is only once every 2 years, but we really strongly recommend that you revisit your communication plan after any event, whether it's a major crisis or a smaller scale event. Refining that communication plan as you go to incorporate lessons learned will really just help you to improve that plan over time. So again, one of the most important things you can do with your communications plan is making sure that you are reviewing it and making those adjustments as needed. So just always consider asking yourself if there are gaps in your communication plan. I know we all work really hard on our emergency plan, but just always be poking holes in it. That's the best way you're going to improve it, is just asking, what would I do if this happened? If there's anything that was identified during an exercise or test or a real world event, making those adjustments as needed. And then finally, just making sure that you're frequently updating your points of contact across health facilities, public health, emergency operations centers, any hotlines or media contacts. I really just want to recognize, I know there's been a lot of burnout when it comes to working in healthcare, emergency preparedness, or public health in the last 2 years. So we're really seeing a lot of staff turnover at this time as people are recognizing they need rest and they need to take a step back. So if you ever get any bounce back from an email or you haven't heard from someone in a while, just go ahead and outreach to that organization and ask if they would like to update their contact information so that you know who you can turn to during an event. So we know you all are very, very, very busy, and a lot of you wear a lot of different hats and support many different functions at your community health center. So we're just going to list out some best practices when it comes to crisis communications that could really help your organization effectively communicate. So thinking across different groups, there are many different ways to think about those external audiences to your community health center. We did some organization here, but this may be different from some of your primary audiences. But for the purposes of this discussion, we just kind of separated them out here to list out some of the various systems or networks that you may coordinate with. But when you create your map and the systems that you work with, we really just urge you to make sure you, again, have the appropriate points of contacts for each entity. You've tested that communication channel with them, and that you just frequently check in with them to identify any potential improvements that could be done with communicating with them. I know this looks a little chaotic, but this is a graphic that we're borrowing from HRSA just to kind of show you how information typically flows from federal systems, state, local, down to program participants being the community health centers or federally qualified health centers. So, if you're ever curious about how information typically flows, you can just feel free to refer to this. So you may be able to know who to tap into if you're looking for any specific information. So thinking about modes of communication, we just wanted to point out that there are some software that you can look into acquiring for your community health center. It helps you have preset messages, for example, that you could quickly push out to staff or patients. So for example, you can maybe push out something that says, press 1 if you're okay, press 2 if you have an unmet need, anything like that. It's a good way to quickly collect information. We just encourage you that if you do look to get something like this, that you've tested out the systems with your staff, or if it's for your patients, that you've let them know ahead of time that this is something they may receive. You know, in the day and age where I think all of us get a lot of junk calls or texts, just making sure they know to look out for any of these messages if you choose to use it. And then on tools, you know, there are many options that you could leverage during a crisis to help you get information out to your organization or your external partners, whether that's WhatsApp, email, text messaging, landlines, using social media, any instant messaging like Slack or Teams that your work may use. And then, of course, radio stations, which is a great way to get information out when a lot of our systems are typically down. So just going a step further and thinking about how to best use these modes of communication. When it comes to email listservs, these can include either like emails or any of those text-based systems that we used before, but they really help you develop and manage a partner distribution list. And this could help with, for example, coordinating with your primary care association, Department of Health, or any other entities you want to blast out information to. With something like an email listserv, you also want to make sure that you yourself and your community health center are on the right listserv so that you could also be receiving information from appropriate stakeholders. When it comes to physical co-location, this is really important when it comes to emergency management. A lot of times we'll see emergency operations centers will offer to have someone on site at their EOC. So if this is an option, just encourage you to look into it, but we know it may not be something that's available across the nation or for every community health center. We spend a lot of time on briefings and coordination calls. We really use it as an opportunity to share information out about where we're supporting, but also to pull information in. When coordination calls are well utilized, they can save a lot of effort, a lot of time, and oftentimes a lot of lives. Coordination with local media. This is a really great opportunity if you have contacts at the media, and it's also usually free. You know, identify who a point person would be at your organization who is comfortable and able to share information externally with local media. And then finally, centralizing information. So this would be like a hub or any type of like online source where there's a lot of bidirectional information sharing and going on. Just going to do a little bit of a deeper dive into some of these components. So coordination calls can be a really great tool, but we really just make sure that you're testing the cadence of them so that you're not potentially over tapping your partners. The benefits are really clear, you know, real-time problem solving you can make or refine requests for assistance or information. Some of the potential setbacks are that, of course, if systems are disrupted, this may not be an option for your community health center. So just making sure that there's redundancies for what would happen if not everyone in your community can get on a call so that you're still able to get that information to the right people. For communication calls, it's also important to identify upfront who would organize the call, who would take on those logistics, and just making sure that you're managing them responsibly. And then finally, making sure the right people are in attendance. You have the right briefers so that, you know, everyone who's on the call, it's beneficial for them and they're getting the information they need. Alternatively, and if you determine that, you know, you may not have the logistics to support a coordination call, there are usually plenty that happen in your region that you could just join. So whether that's being hosted through your state voluntary organization active in disaster or VOAD, a business emergency operations center, your primary care association, or any of your local healthcare coalitions. Again, the benefits are very clear. A potential setback could be that you would probably have a little bit less control about the briefers that could be on the call, but we found in our experience that organizers are usually very open to taking suggestions for briefers. So you would always have that open line of communication to reach out. So distribution lists can be a huge benefit. They really help you to quickly blast out information to a large list of people, and it can help you manage your record keeping rather than relying on phone calls. However, potential setbacks may be that your community health center could become too dependent upon an email style or a specific person to manage those listservs. We have also learned during COVID that a lot of us are experiencing some fatigue when it comes to emails. So, definitely give people as they're signing up for any distribution list the opportunity to sign up for just preparedness, just response, or both if they're interested, so that you're not over tapping them with any messaging. Coordination with local media. So this is especially important for communicating with the public and with your community that you serve. It's just really important that you make sure you have a strategy for how you will partner with local media, just to be really sure that you're able to take advantage of it and that you're able to do it correctly and that you have the ability to control the message. Recommending that you use that trusted voice in local media to push out that information to a wide audience. But you'll just want to make sure that you're really clear on the cadence of that information, so that you're clear on how often you would need to update local media, how frequently you need to refresh the information you're giving them, or if they need new information as a situation develops. A couple of considerations, again, just to encourage you to maintain your media contacts and maintain your relationships with them. We recognize that a lot of you are in disaster-prone areas and may only need to coordinate with local media during those peak disaster seasons, but we really encourage you to reach out to them in the other months or the off-peak season, so that you maintain those relationships throughout the whole calendar year. And like I said before, recognizing some organizations have shifted to like logins, centralized hubs where you can access updates. These can be really beneficial to improve situational awareness and strengthen information sharing. However, they're extremely dependent on connectivity. So it can be difficult to determine if the information that you're getting is accurate or up to date if an area has been severely impacted and their systems are offline. There's, of course, always a security risk with using any type of online source. So just encourage you to make sure you've connected with your IT team to make sure you're using the safest possible hubs if that is something you'd be interested in. So when it comes to kind of communicating our needs and getting information, we have to make sure that we are talking about support needs and how we communicate those needs, which we typically refer to as requests for assistance or requests for information. There are really two categories that we think about, which are immediate needs and anticipated needs. When we say immediate needs, these are the critical support needs where you're making requests for assistance or information because it would be the difference in your community health center's ability to operate and do the things that you need to do. So here, just make sure that you have the ability to plan out exactly how you would make that ask when it's something, this critical, where the ask would go to, and who you anticipate would be able to meet that need. So really work towards including this in your communication plan when you think about the timing of when you would make these requests and making sure that you're communicating just how critical it is. We often encourage our partners to note the timing of when they're looking to get a response. So you should certainly note, this is something my organization would need within the next 24 hours. An anticipated need on the flip side, which is often a challenge to communicate, is something that you may need if the situation does not improve or does not stabilize. Typically, we see that this time window is from about 36 to 72 hours. So again, with an anticipated need, it's possible that your organization may need this, but it also may go away if the situation improves. So that's kind of why this can be a little bit challenging to clearly communicate an anticipated need. But an example would be something like if you're experiencing a power outage and it's unclear if you'll be able to get fuel resupply to support your generator in the coming days, you may communicate to your partners and say, if we do not get fuel in the next 72 hours or power is not restored, we will be severely impacted and may not be operational because maybe we only have 48 hours of fuel supply on hand. So in that case, if that happens, we may need to make a request for generator fuel. And I know a lot of times it can seem like making those requests would be like sounding the alarm too early, but they can be incredibly helpful in helping your partners determine plans for how they may be able to support you in the coming days. With something like this, it'll just be really important that if the need goes away, that you are communicating that with your partners so that they're no longer putting resources towards this request. And just, building that trust and that partnership that you will keep each other updated through a crisis situation. And finally, just a couple of final best practices for crisis communication. Starting in the left corner, engage in messaging during preparedness, not just during a response. Make it a part of your routine and use what is already out there. Social media is a great way to reach people before a disaster. Anticipate disruptions. Almost always severe weather impacts standard communication methods. So build those redundancies into your communication plan now so that you're able to move out on them when a disaster strikes. Again, capitalize on partnerships. Make sure that you're not only asking your partners to amplify your message, but you are also amplifying theirs. Build off each other rather than duplicating resources. And then again, leveraging social media. Identify local leaders in your community who are trusted voices and turn to them and ask them to amplify your resources. Again, developing those templates and pre-written language so you can push them out quickly during a crisis. And finally, using visuals, which we'll touch on in a couple slides. So for our last section here, we're just going to leave you with some practices for how you can incorporate equitable approaches to crisis communications. So why practice equity? Practicing equity is necessary to creating sustainable and just and fair preparedness response and recovery in all communities. We know that disasters often expose those inequities and vulnerabilities that have already existed in our communities and can even exacerbate them. So equity requires that many systems and structures related to health and emergency preparedness, response, and recovery are actively engaging to address the inequities and disparate outcomes experienced by specific groups, which can include those that are defined by race, income, gender, sex, age, health and medical status, and geography. So as you're starting to think about, I'm so sorry, I skipped a poll. So we're quickly, just before we jump into this section, just, curious to get a sense of whether your community health center does have an equity framework or incorporates equity into your communication plan. And again, there's really no right or wrong answer here. We recognize that there has been a lot of attention on health equity in the last couple of years and really advancing those efforts forward. So if this is something you're currently working on, or maybe you have plans in the future, that's totally okay. Great. So we're seeing a lot of mixed responses and a lot of you are responding not sure, which again is totally okay. We're hoping that you can take these tips back with you to your organization and maybe work together with your leadership or your staff to identify ways you can incorporate equity. All right, so as you're starting to think about equity and how you might incorporate it into your communication plan, it will be important for your community health center to consider and identify the groups that you serve who are at higher risk of experiencing some of those worst health outcomes before, during, and after a disaster. What we have up here is not an exhaustive list, and we know that this is just beginning to scratch the surface, and these are really high level categories. But we just wanted to provide you with some examples of some of the groups who may have communication needs that are unique and require your community health center to take a different approach to tailor messages to those specific populations to the extent possible. So rural communities, older adults, persons with disabilities, people with chronic medical conditions, tribal communities, children, pediatrics, low-income individuals, people experiencing homelessness, anyone without internet access, communities of color, excuse me, immunocompromised individuals, and other vulnerable communities who may not be listed up here. So to give you an example of some of the vulnerabilities that these groups may experience during a disaster and how you could identify potential groups that could be impacted, we've provided a couple of examples here. So for individuals with transportation or mobility needs or issues, the content of your messaging may be more focused on the different services that are available to help individuals actually just get to your community health center, or how to get to pharmacies or other health facilities that could help them either get the medicines they need or get the services that they need. For groups that require non-traditional communication methods, whether that be due to age, so maybe they don't have the knowledge to use certain technologies, or they may not have access to the internet or certain technologies, or maybe they just speak a language other than English as their primary language, which is, of course, extremely common across the nation and many communities. It's important that your communication plan identifies how you may be able to push out messages to these different groups to help meet their needs during a crisis. And then lastly, example we have here is access and functional needs. So when we say access-based needs, those are needs that require resources to be accessible for all individuals, such as social services, accommodations, information, transportation, or medication. And function-based needs really refers to the restrictions or limitations an individual may have that requires assistance before, during, and after disaster. So here it may be, higher communicating to groups who may require physical assistance, or may just require modified information to ensure that they have equitable access to resources and information. So just to give you some examples for how you could achieve equitable outreach for these groups who may have certain vulnerabilities, we've just provided you with a couple of examples here. If you have groups who may be experiencing language barriers, use translation services. They're free and available online. But if you're looking for longer messages, maybe identify any trusted messengers or partners in your community who are bilingual and can help you translate your messages to reach communities. For groups that have limited media access, use multiple methods. Like we said earlier, the radio is a great way to get information out to a wide array of groups. For socioeconomically disadvantaged groups, providing informational resources at low or no cost, or even applying for grants to supplement costs that may be used to create some of those additional resources. And then finally, for groups, individuals experiencing homelessness, you may be able to organize volunteers to perform outreach, or there may already be organizations in your community who support these groups and may be able to disseminate information. As an example of a way to disseminate information to a specific group, we really rely on social media cards where we're able to aggregate a lot of different resources in one place and push them out so that that group can capture a wide range of information that's available that they may be able to turn to. And finally, we just wanted to leave you with a list of a couple existing resources that you can always amplify during an event that are available for patients who may need extra assistance. For transportation, rideshare services like Uber and Lyft typically provide free rides from shelters after a disaster. Similarly, Airbnb for housing typically provides free housing for survivors. We see a lot of telemedicine. Organizations or insurance companies provide virtual free services to groups who may be displaced or may have transportation or mobility issues. And then finally, oftentimes hotlines are stood up in which survivors can access crisis and medical support if they have been impacted by a disaster. So you may see like the 211 line is a great resource, for example. With that, you know, I'm not going to go through these slides, but we have provided several resources for you all to turn to, including some communication plan templates that you can leverage during when you're building or refining your communication plan. We also provided some federal resources that you can turn to, as well as educational resources. With that concludes the presentation for today. I know we went right up to time, so we're happy to stay on for a little bit longer if anyone has any questions. But otherwise, you'll receive a survey when you leave today. We certainly invite you to provide any feedback on this training or any future trainings you'd like to see as part of the Archer initiative. Again, we'll be sending these slides out to registrants, so you should expect to get those before the end of this week for your reference going forward. So thank you all for your time today. Again, if you have any questions, please feel free to drop them in the chat or go ahead and raise your hand. We're happy to chat for a little bit longer.
Thanks, Melanie. I'm just going to live respond to any questions that come up on the chat. Will a recording of this webinar be available? Yes, absolutely. All of the recordings are available from these webinar presentations on our website. I'm happy to redrop the link in the chat. Thanks so much for joining us, Brenda. I really appreciate all your questions. I see a hand raised, Florence. I'm trying to allow you to talk. So feel free to come off mute and ask your question. Florence, you should have the ability to unmute. Oh, there you go.
Hi, I was raising my hand to say thank you. And that was very informative, and mostly the fact that the slide will be available for additional staff training, because out of my organization, I was the only one able to log in. So I really appreciate that.
Oh yeah, absolutely. So following the event, as long as you're registered, everyone will get a copy of the presentation. And of course, as you mentioned, the recording will be made available on our website next week. If you have any questions along the way, if you have questions on the resources that are listed there, how to use them, you can always feel free to come back to us and ask those questions.
Thank you.
Yeah, you bet. Thanks so much for joining today. All right. Wonderful. Awesome. I think we're good to close. All right. Thanks, everyone. Thanks, Melanie.
Thank you, everyone. We'll be in touch with the slides and where you can access the recording. But otherwise, hope everyone has a great rest of your week. And hopefully we'll see you next time for the next Archer webinar.
Bye.